There's nothing a doctor loves more than being able to make a definitive diagnosis based on a blood test. But for sickle cell warriors having an acute vaso-occlusive crisis in the emergency department, this reliance on blood tests can be very problematic. And we're focusing on one blood test in particular in this explainer series, and that is the percentage of sickle hemoglobin in the blood, which some clinicians use to diagnose pain. So here are 4 very scientific reasons why it's wrong, and we'll get to the ethical implications later on. So reason number 1 is that sickle hemoglobin percentage cannot tell doctors if vaso-occlusion is happening right now. It doesn't show whether the remaining sickled red blood cells are actively blocking small blood vessels. Vaso-occlusion is a real-time microscopic event that hemoglobin S percentage cannot detect. So number 2 is that sickle hemoglobin percentage cannot tell doctors if pain pathways are active. It doesn't measure the nerve signals in the brain or spinal cord that generate the very specific feeling of ischemic sickle cell pain. That pain can't be inferred by a blood percentage. Number 3 is that sickle hemoglobin cannot tell doctors if tissue hypoxia has started. Oxygen deprivation happens at a local tissue level in the joint or muscle that's affected by pain, and that's before anything abnormal appears in the blood tests. You can have a good hemoglobin S percentage, but still have areas of your body starved of oxygen causing severe pain. Lastly, point 4 is that sickle hemoglobin cannot tell doctors if inflammation is already driving a crisis. Once sickling begins, inflammatory pathways can rapidly amplify pain and blood vessel narrowing. Hemoglobin S is just a static number and gives no insight into this active inflammatory cascade. So now the relevance of hemoglobin S percentage actually comes from its use in population level stroke data. It was never meant to be used as a real-time sickle cell crisis pain detector. Okay, so in part 4, I'll talk about the diagnostic leap that's made because of this misinterpretation. If you'd like to read my full article on this subject, I posted it in the Sickleverse, my online community, which you can join via the link in my bio.